pilot trial.
Hello and good morning, and thank you very much for the invitation. It's a great honor to present the first results of our trial here today. Creative music therapy is a family integrating, relationship-based approach. Infant-directed singing is provided at the bedside with the infant and or together with the parents. The aim is to stabilize and relax and stimulate the infant, as well as to empower the parents through meaningful vocal interaction, for example, through joint lullaby singing. The singing is individually tailored to the needs of the infant and the family, to the musical heritage of the family, the culture of the family, and entrained to the breathing rhythm of the infant and the subtle expressions. And to give you an idea how that looks like, I want to share a video example with you. And I would like to ask you to observe facial expressions, eye movements, mouth movements, and later in the video also finger movements. Perhaps you could see relaxation, stimulation, and also communicative musicality. So really something is going on between the therapist and the infant. Brain development is linked to early auditory stimulation and also early social contact. And particularly music has the potential to promote neurobiological processing and neuronal learning. And since creative music therapy integrates both social contact and music, our hypothesis was that creative music therapy improves brain development. We conducted a prospective randomized controlled trial. We included 82 clinically stable infants born before the 32nd week of gestational age. The intervention was creative music therapy 3 times a week, 2 times with the parents together, for example, during kangaroo care, and once a week with the infant at the bedside. The control group received standard care, and the primary outcome was feasibility, which was successful, and MRIs for brain structure and function at term equivalent age. We could include 40 infants in the final MRI analysis, and the MRI cohort did not deviate from the remaining infants in the study in clinical parameters and demographic parameters. I will focus today on the results of the resting state fMRI. When the synchronicity between brain regions is delayed, you call that lag, and we measured this delayed synchronicity with the lagged resting state fMRI analysis, and we found a difference in the synchronicity between thalamus and cortical regions. That was significantly improved in the music group. In other words, creative music therapy significantly improves thalamocortical processing, particularly, as you can see in A, in the left prefrontal regions, extending to orbitofrontal regions, and the left supplementary motor area. Further analysis of subsignificant results on T-statistic maps in figure B suggests that the effect may be bilateral, with only the left side showing conservative significance levels. And in these maps, you can also see that the left superior and inferior temporal gyrus was affected by music therapy. In C, you can see the strong between group effect, and in D, very interesting, a dose-dependent effect. So the more sessions the infants received, the stronger was the effect, and the lower was the thalamocortical delay. The group-level independent component analysis and dual regression revealed improved functional connectivity networks in the music group, as you can see in A, bilateral frontal in red, and in B, in blue, significantly improved in the left precentral gyrus and again in the supplementary motor area. In C, again, the between group effect, and in D, you can see the dose-dependent effect. To conclude, creative music therapy improves thalamocortical synchronicity that is often impaired in preterm infants and correlates with cognitive performance. We could show stronger functional networks, higher functional integration in predominantly left prefrontal, supplementary motor, and inferior temporal brain regions. And these results are in line with studies in music and neuroscience, where extensive musical training is associated with improved functional activity and connectivity in similar areas. For example, in the superior temporal gyrus, associated with emotion and speech, in the prefrontal gyrus associated with executive functioning, often impaired in preterm infants, motor regions often impaired in preterm infants, and supplementary motor regions. This is very interesting because till now supplementary motor regions are only reported to be improved to long-term extensive musical training, really playing an instrument and not just listening. We found a left hemispheric dominance in the prefrontal area, and this is associated in newborns with positive emotional experience. A dose-dependent effect is also consistent with the literature. However, it took not several years, it took only a few weeks, like 10 to 15 sessions, and this may indicate that the NICU time is not only a very vulnerable period for brain development, but also a window of opportunity for potentially neuroregenerative and neuroprotective therapies. Of course, the question remains, will our first results I presented here today correlate with neurodevelopment with 2 and 5 years in that population? And of course, we have to confirm these first results with larger trials. And yeah, thank you for all the families and infants, and of course, the team that supported all that work over the last years in Zurich. Thank you.
Thank you very much. So the paper is open for discussion. Just to say that if you don't want to stand up, you can send SMS by the MCA app. So I think Petra is there.
She likes to do a little physical activity and get up. Thank you, Friederike. This is wonderful work, and it's very reassuring to see that you actually find similar brain regions influenced by the creative music therapy, as we see recently published on a purely instrumental intervention to the baby, given entirely to the baby. So 2 different approaches, similar results, that's always reassuring. But on the other hand, I think we have to sort of critically review our thinking, what is behind music or the way we give music. And I recall a paper by Walsh on the family-centered care intervention, where she showed with an EEG approach, the high-density of EEG approach, that exactly these same areas were enhanced. So with a therapeutic intervention that was more parent-oriented, but didn't include any music. So what's your view on that?
Yeah, so that was exactly the base. So I thought, okay, there are studies out in music who show that we can improve these areas, and there are studies out with family-centered care or integrated care that show that with early social contact, meaningful interaction, we can improve these areas. And yeah, so this was the background of the hypothesis, and I think in this approach, this is really both. It's the music, but it's also meaningful interaction that may improve, but I cannot give you an exact answer to that. So we're still at the beginning, and I think I have much more questions after that study now than before, because the question is, of course, why these areas and not other areas, and the study had a small population, so I think it's worth to further investigate in that area.
Thank you. Okay, here on the right.
Hi.
Can you introduce yourself?
I am Friederike from Utrecht. My question was, were you able to dissect inside the thalamus also the auditory parts, so the medial geniculate, in your MRI?
Sorry, could you repeat the question? I could not understand.
Were you able to dissect or delineate the auditory part of the thalamus in this study? Because I figured that the auditory stimulus of the singing would come in through that part in thalamus.
In the thalamus?
Yes.
Thalamus, the auditory area of the thalamus?
So the question is if we found improvement in the auditory cortex? No.
No, in the thalamus.
Yeah. So in the thalamus and spreading out to the cortical region. So the thalamocortical connectome was improved. Yes. And so when to understand music processing, the signals come to the thalamus, and then we digest music by spreading it out to different areas and then putting the music again together.
Okay. Thank you for now. I'll approach you later on.
Okay. So maybe last question from Ulrike. Aden?
Hello, Ulrika Aiden from Karolinska. So first I'd like to congratulate you on this study because it's really a difficult study to perform, so well done. As you know, we're doing a similar thing in Stockholm with parental singing, and I was thinking if you have a dose-dependent response, have you thought about involving the parents more so that they can continue the intervention after discharge?
Yeah. Yes, of course. So I had only 10 minutes to present. So the aim is really to engage and motivate the parents so that they sing for the baby. Because a music therapist is only there in the NICU, but the parents will take the baby home. And what we would like to do in the next study, really to have a diary of the parents, how often did they sing. But we had a sub-study of this study with a project with also questionnaires for the parents and interviews, and all the parents who participated in the study started to sing, even the parents who said, no, I cannot sing. So it's not singing, it's just humming, so everybody can hum a few notes.
So it can really change parental behavior on a
yes,
long
yes, and this is the aim, really to also to improve attachment and bonding, because to sing a song for a baby is very emotionally, and really to get the parents into that emotion.
Okay, so we have to move on. Thank you very much.